Today we want to discuss some of these new requirements and how you can protect your health. But first, let's explain blood-borne pathogens. AIDS can be contracted through the exposure of the virus by direct contact of blood and blood products. Exposure to blood and body fluids can also transmit other serious diseases, such as hepatitis B, and others. However, precautions taken for HIV and hepatitis B are satisfactory to prevent these other blood-borne pathogen diseases. When we talk about occupational exposure to blood-borne pathogens, the information generally applies to your normal, routine duties, but contingency plans for an emergency or accident must be considered. If your job is such that you could possibly be exposed to blood-borne pathogens, then you need additional information and precautions to prevent exposure.
Hepatitis C is a virus that is passed similarly to hepatitis B, and it affects the liver by causing usually inflammation of the liver with chronic scarring of the liver. And people who have hepatitis C are at risk for developing cirrhosis after many, many years, usually 20 years after exposure.
In the workplace, exposure can occur from accidental injection with contaminated needles, broken glass contaminated with blood, blood spattering and splashes to the eyes or mucous membranes. Exposure from cuts and abrasions in the skin are also possible for transmission of these pathogens. Let's now discuss an exposure control plan. This is an organization's written plan to outline guidelines to reduce occupational exposure to these diseases. The plan must be accessible to employees and available to OSHA upon inspection. In addition to personal hygiene, one of the most effective means of prevention is through engineering controls. This means controlling or eliminating the hazards at its sources. Work practices are specific procedures that employees must follow to reduce their exposure to pathogens. These include, but are not limited to, personal hygiene and proper waste disposal. You must assume that all blood and body fluids are potentially harmful and contaminated. When handling filled biohazard bags, use caution, as the plastic bags may contain broken glass or needles and can penetrate your skin through the plastic. Never pick up any broken glassware with your hands. Use tongs or a broom and a dustpan, never your hands. Regular hand washing, particularly with antibacterial soap, is mandatory immediately after removing gloves or other protective equipment after they've come in contact with blood or body fluids. The selection of personal protective equipment depends upon the nature of the exposure, but generally includes gloves and skin protection. Remember, the idea is prevention and protection. For first aid emergencies, rubber gloves, face mask, and eye protection would be considered minimum protection, but your employer must make the decision for appropriate personal protection based upon the potential exposure. Always discard the gloves after contamination in a proper biohazard bag, then immediately wash your hands with antibacterial soap if at all possible. All potentially contaminated surfaces, equipment, personal protective equipment, and other areas require cleaning and sanitizing. Always wear gloves and other protection as necessary when handling contaminated clothing, towels, laundry, and always be prepared for sharp objects to be left on clothing and laundry. If you're in a job where you're routinely exposed to blood-borne pathogens, your employer must make available the Hepatitis B vaccine. This vaccine must also be made available to you in the event there is an exposure incident. There is no requirement for you to be pre-screened before taking the Hepatitis B vaccine. In the event you experience an exposure incident, such as a needle stick, contamination of the mouth, eye, mucous membrane, or other puncture of the skin. Basically, wash the exposed area with water, report it to your supervisor immediately, and seek medical attention as quickly as possible. Fast action is the key to prevention. Your physician will discuss all pertinent medical evaluations and diagnoses with you, but will not reveal this information to your employer. Your rights to confidentiality are protected. It's your responsibility to follow your employer's rules and exercise good judgment when handling laundry, clothing, or working with any contaminated work surface or area. There are other rules and regulations that apply to preventing exposure to blood-borne pathogens. You'll be provided additional information and training to help you do a better job safely.
The first part of required information and training is employers shall ensure that all employees with occupational exposure participate in a training program, which must be provided at no cost to the employee and during working hours. Annual training for all employees shall be provided within 1 year of their previous training. Other requirements. The Blood-Borne Pathogen standard is very comprehensive and requires compliance in all parts of the standard. Employees who may reasonably anticipate being exposed, such as first aid providers, emergency responders, hospital workers, and similarly employed persons, must be trained.